We are back with you answering your COVID and vaccine questions. Cone Health's Chief Physician Executive, Dr. Bruce Swords, is with us. This is a question that we've been answering for weeks now. I know some people have been frustrated, but I know the process is getting better. This person says, I can't find a vaccine appointment available. Any suggestions?
I'm not sure I'll have suggestions that you haven't already tried. I do think there is good news with FEMA opening a mass vaccination site at the Four Seasons Mall that will make vaccines more readily available for people who fit the criteria. My recommendations are either to go to the Guilford County website or the Cone Health website, and there will be links to get you to the right registration, even if it is through FEMA.
Mm-hmm. This person is asking, can alcoholic drinks affect the shot received?
Again, there's not been any studies that would speak to that. And what I would say, first of all, is probably not. There's no reason. Certainly, you should avoid over drinking. So that's pretty easy answer. And look, I think that more that you avoid smoking, alcohol before the vaccine, the better. And again, that's just my recommendation as opposed to based in science.
This person is saying, I just came out of quarantine February 26th. How long do I have to wait to get the vaccine?
Yeah, so I'm going to make some assumptions here that you had COVID, and so you're out of quarantine February 26th. I would say 45 days after that would be the right time to get the vaccine.
Mm-hmm. This person is asking, I have not been feeling good, cold, coughing, but no fever. Is it okay to get my second COVID vaccine in the next day?
It is. And so without a fever, sort of minor symptoms, I'm a big fan of getting the vaccine when you're eligible and when you can get it. So my recommendation is if you've only have minor symptoms of some upper respiratory infection, go ahead and get the vaccine.
Mm-hmm. This next question is about the variants, and they wanted to know if Cone Health is testing for those new variants.
We specifically at Cone Health, just like most hospitals and health systems, are not specifically testing for variants. The way that variants are identified is really the state or counties will do random selection of tests and randomly check and see if a positive test is a variant or not. And so that's the way we're approaching it, just like most health systems.
Mm-hmm. This person is asking, how long can you experience no smell and taste after COVID? I had COVID the middle of December, and I'm still experiencing some days of no taste and no smell.
That's a good question. And the answer is it's variable. And so there are certainly some people who have lost taste and smell and they recover it within a week or two. And there are people who have gone several months without regaining full taste and smell capability. And so there's no hard and fast rule around when symptoms might happen or when they'll go away. Chances are they will go away. We just can't predict the time.
Mm-hmm. Right, this next question is the vaccine safe for African Americans? And I know we did spend some time talking about that in the last couple of weeks with the African American community, sometimes being distrustful due to the Tuskegee Project and others. So again, this question is the vaccine safe for African Americans?
It's a simple answer, and the answer is yes, and get the vaccine when it's available. And to just try to reassure as much as I can, all of these studies, whether it's the Pfizer vaccine, Moderna, Johnson and Johnson, there's a wide distribution of people who were in those studies, African American, Latino, Caucasian. We know it's safe, we know it's effective, no matter what population it's given to.
And I know North Carolina A&T just had a virtual town hall, or is getting ready to have a virtual town hall with Dr. Corbett, who was an African American scientist who worked on the Moderna vaccine. So go to their website as well and look at that so that you can educate yourself and see and get a lot of your pinpoint questions answered there so that you can feel safe about going to get your vaccine. All right, the next question is, can a person ask for the vaccine that they would like to have, like Johnson & Johnson or one of the other two?
Right now, probably not. And that's because none of us who provide the vaccine really are certain which vaccine we're going to get that week. That might open up over the next few months where people can be more selective. My suggestion is get the vaccine that's available to you. We know that they're all effective, and we know that they're all very effective in preventing serious disease and keeping people out of the hospital.
This person says, should I get the vaccine after my mammogram? I had breast cancer a few years ago. I heard it makes lymph nodes swell in some people.
Yeah, I think you asked the right question there. After your mammogram would be the best time to get it. If your mammogram is a couple months from now, for heaven's sakes, get the vaccine now. I think if you give 10 days between the time of your vaccine and the next mammogram, that's probably enough time. But certainly after the mammogram is perfectly reasonable.
And we did a story on that as well, so you can find that on the WFMY News 2 website. Dr. Swords, thank you so much for taking your time once again to answer these questions. Folks at home, if you did not get your question answered this time, I urge you to go online because WFMY News 2 has been doing this every single Monday, having an expert from Cone Health one-on-one answering your questions. You'll find all of that on the WFMYnews2.com website.